All right. Hello, DSN fan. How are you? Michael Lomatan here again, co-founder of DSN. And today we're with our good friend again, Dr. Paul Goodman, CEO of Dentist Job Connect. You guys know Paul in the community, in the DSN community. He's always chiming in there. He's got I think one of the best jokes in the world of dentistry. I think as aside from being a dentist, he's going to be a basketball player, a community, and dental practice owner. But today we're going to talk about Dentist Job Connect. And actually, we're going to bring on also a little special guest who's also a DSN, DSI member, Dr. Michael McKay. He's from Washington. And we're going to talk today about hiring. And I know there's a lot of discussion going on inside the community about what's the right way to hire an associate, what are the I guess, upfalls and pitfalls of hiring an associate, and also talking about Michael's experience with using Dentist Job Connect. So, Paul, I will let you start. You can introduce
Awesome.
yourself.
Thanks, Michael, for those compliments. And we were chatting. People take one thing away. You want the most amount of options for one of the most important positions in your practice, Michael. And I will argue one of the most important people in your life, because practice owners will often say their associate dentists have unlocked so much awesomeness. So we're going to bring Michael McKay up in just a few minutes, but I just want to share, why did I even start Dentist Job Connect? What motivated me to do this? And this is my quote here. Michael, sometimes one of the worst things to happen to you is one of the best things to happen to someone else. In the middle here, next to my two daughters, is Morgan. And during the pandemic, Morgan came up to my wife and I and said, hey guys, I need to tell you something. And I have found, Michael, that there's 100% chance that the next thing that person is going to say is something that I am not going to like. So she said that, I've lived in Philadelphia my whole life. I just graduated college. I want to move across the country to San Diego and meet new people. Now, before I tell you why I was going to cry inside, I want to tell you who Morgan is. She saved our life during the pandemic. She took care and babysat, but to call Morgan a babysitter would be an insult. She took care of the two most important people in our lives, our two daughters. So I said, oh, Morgan, that sounds like a great plan, but I have bad news. San Diego is closed. They are not taking any new residents.
We're a terrible city. I mean,
But she didn't believe me. So I immediately had to start scrambling to find a new babysitter. And then just a short time later, Michael, my associate dentist, said, hey, Paul and Jeff, my brother who runs the practice with me, guess what? Another phrase where you usually don't get something good on the other end of that sentence. And he said, my wife got into a neurology residency in San Francisco, everyone going to your side of the country, Michael, and I'm going to be leaving your practice. So I said, there's got to be a better way to replace the most important people in your life who take care of the most important things. This was me sharing at a meeting, how do you recruit high-level associates and replace them in your practice? I'm glad to share this video with anyone who would like to have it later. But I created Dentist Job Connect to make this easier, Michael, to make this more affordable, to make this more fun, and to use a dental pun, because I know you're infected by dentistry. Would you say that, Michael? You're not a dentist, but you're infected by it.
And vaccinated too while I'm at
it. Yeah. Bond dentists together to unlock the F's that are so important: clinical freedom, free time with your family, financial growth, and most of all, fewer hygiene checks. Because 100% of dentists, Michael, would like to do fewer hygiene checks. So we're going to bring up Michael McKay here in just a few minutes. But before I bring him up, this community is absolutely one of my favorites. People who know me through Dental Nachos know that the greater social media community can be rough sometimes. So when I run into the DSN and talk to you amazing people, I really appreciate it. And I'm glad to have helped dentists just like me. Like at this meeting, here with Dr. Blake. This here is Dr. Blake Drew, Michael. And I know the DSNers and the DSIers, they are go-getters, but sometimes they have to roll up their sleeves and look through the resumes themselves on Dentist Job Connect. So to provide some context, I met a dentist at the Dental Success Summit, and he got 45 applicants in about a month for his job. Michael, where do you think, what state would you guess that job is in if he got 45 applicants in about a month?
45 applicants a month. I'm going to say either California or New York.
Close, but this is Texas. He was in Texas, okay? Oh. Texas is the most dentists, okay? So Blake is in Oregon, and we advertised his position. I think he got a few applicants, but he went through the resumes, and he reached out to dentists. We give you access to over 2,000 resumes, and he brought one into his practice who's now working with him. Let's take this 23 seconds when we were at the last DSI mastermind and see, I just want to make sure my sound is being shared here. See what kind of impact I have made on Blake. Blake Drew. This is Dr. Nacho, founder of Nachos and Job Connect, and creator of Joy for Dentists. Because Blake, how do you have your associate dentist? How long or how'd you find your associate dentist?
On Dentist Jobs Connect.
Now, every day you go into work and you have your associate dentist. Are you grateful to have that associate
I'm
dentist?
extremely grateful.
So basically, my grandmother's right. I am very special.
She was spot on.
Thanks, Blake. So that's the fun I like to bring to Blake Drew. Our team is awesome, and we really care so much about creating amazing relationships. I'm not supposed to have favorites, but Dr. Luda is one of my favorites. I'm proud to say that, my ex-wife, and we help them find an associate dentist. We talk to them at the summit. So this is what we love to do, transform the smiles of dentists. And before we bring up our star of the day, DSI and DSN, any questions you wanted me to answer before we bring up Michael Lomaton?
No, I mean, this is awesome, right? Because I've gone through I'm responsible for the hiring and the interviewing in our office. And so California, it's actually enough people want to move to San Diego that there's actually no shortage of applicants, but still hiring is tough over here, especially in California, right? So trying to select for the right applicants, I did notice that most of them are actually out of state. So using a third-party service, if I currently outsource my HR, so moving forward, I was thinking like, why not outsource hiring? Because frankly, getting time in the day for me on top of running DSN, trying to interview literally 20 potential candidates, not fun.
Yeah, and you want these positions are transformative in both ways, success and stress, and it's the right position for your patients, a right dentist, and you just want as many good options as possible. So Dr. Michael McKay, our superstar of the day, would you like to join us?
Love
there
to.
He is.
I feel like we're gonna have to do something like back when I did in like elementary school, where it's like I'm Michael M, this is Michael L, like a last name.
That's great.
Or, you know, like we're gonna have,
yeah.
Is it
there's like too many Michaels in one room was always a problem back in the early 90s. So
yeah, exactly. Because if you go to any of your children's classes right now, there's no Michaels, there's no Pauls, there's no Davids. Completely out. It's going to come full circle again.
Yes.
Just by our names alone, we know what kind of
Ethel's going to come back. That's my grandmother's name, so it's going to come back. Now, I like these stories, these movies, both Michaels, where like you see the end, then you go back to the beginning. So this was just like 2 months ago, and you seem pretty happy with Morgan from Job Connect at the Dental Success Summit, Michael McKay. How come you're so happy?
Well, I mean, anytime I get to go out and hang out with the group of guys and gals that I've met at the DSI network events, I mean, I'm usually always in a good mood. It's work, but it feels more like vacation, to be honestly. Like I was just down in one in Charlotte, and I wasn't planning on going because I live in Washington, and all the way down to Charlotte's a bit of a hike for me, especially I live in rural Washington. But they're like, you got to come down. I'm like, all right, twist my arm, you know. So I always have such a good time and such a great mood around that. And also, help me find an associate. So I had my office open and running when I'm not going to be there. So, you know, that's also a good mood too. So I'll take that. I'll take it up and slam dunk it for you. Just.
I like it. So you're here with Morgan because Morgan made this happen from Dentist Job Connect. And when I did see you in Charlotte, the first thing you said, I said, "Hey, Michael," and you just got off a scooter touring a brewery. So you do like fun. Is that true?
I mean, life's short. That's one of my like principles. Like actually in my office is like you got to enjoy the day, because you never know which one you're gonna have next. So, you know, when you're in Charlotte, jumping on a Lime scooter and go and check out a brewery. Now, I took an Uber back. I did Lime there, then Uber back.
That was smart.
I was responsible. Yeah, I'm still a clinical dentist. I got to watch out for the body still.
So our awesome team, Michael, Morgan, Kate, Serena, they think of these positions like extractions, right? Some of them are tough. They're hard extractions. So tell us, and Morgan was so proud and we're so excited about your associate dentist. Why was it one of the tougher positions to fill? Tell our audience why your position was difficult to get. You didn't get 45 applicants like the one in Texas. You got 3 applicants, but 1 worked out. Tell us about that. Why?
I actually got 2 really good applicants. I had 2 excellent candidates. It's just one was just like edged out the one. So I honestly felt bad because I had such 2 high quality candidates and I liked them both so much that it was really hard for me to let the other one down. I felt really bad about like saying no, because they were both such nice guys and I really liked them. They both were good culture fits. It was literally like just like a razor's edge, and you just kind of somehow have to make a decision. So that was kind of one where I actually had a choice, which before I never had a choice, but I actually had 2 candidates. I would have said yes to either because they both were really, really like sterling people. I live in Yakima, Washington. You go, where's that? And I go Central Washington, and you go, where's that? And I go, it's on the east side of the Cascade Range. So, I have a little airport that has one flight out a day. I mean, that's it. So, it's not a high area where people initially look at and go, you know what, I'm thinking San Diego, Atlanta, Yakima. It's not on the list. So you have to kind of make it on the list. You have to kind of figure out why your position and why your market needs to be on the list. And that was the challenge, was trying to communicate that to patients in a or not patients, but prospective doctors in a small little blurb online. Like Yakima, great place to come. We're close to the mountains. Like, who cares? So, that's why it was a kind of a challenging location, is because it's not like something anybody has heard of. Once you get them out here and they can see it, then they can start going, okay, you got a Costco, livable town. So it's definitely one of those ones where, having the ability to, or having the lack of ability to try to describe your opportunity and location in an Indeed, paragraph is just really hard to really to do.
I love that. I want to ask you, Michael Lomatin, because how many associates work in your practice?
We have 2.
You have 2. And Michael McKay, how many do you have now?
Well, our second one's starting in 2 weeks here.
And, there's such a great story with Dr. Jessica Christie, Mark's connection at DS. We just found her first associate. Maybe, I'll be glad to answer last. Like, why did you want to hire an associate to start with, and then your second associate? Maybe you can talk about some of your growth, Michael McKay.
So, as far as why 1, why 2, why 3, why whatever, as far as why 1 and 2 is, we're in a, there's only so much you can do out of your own hands, right? And you hit the point where you've met the sky, or what you start doing is you have to pare down patients, pare down plans, pare down, and there's a model for that as well. But I hit a point in my practice career too, honestly, where I was finding more joy out of coaching and talking to people versus clinical dentistry. While I still enjoy it, is not where my path is for my next stage in my career. And so being able to become a mentor and, talk to younger guys and help them grow into having a successful life, and young gals into a successful life and a successful practice model, and be able to provide that for them, started to become more of an interesting pathway for me as far as what would bring me joy and happiness. And if you've met me, I never shut up. And so having a captive audience of somebody who will listen to my stories and be like, oh, that's cool. That's cool. Yeah, I'll do that. I was like, well, what do I really want to do with the rest of my, kind of career? And that was a big, big part of it.
I love it. More options for the most important position. I also feel that happiness in dentistry clinically is dosage dependent and day dependent. And I don't know, Michael Lobaton, what was the motivation in your practice to hire associates?
Yeah, just like you're saying, right? You're trying to find the IC50 of your dose dependent, whether or not you're going to stroke and having 2 people. But it was actually give some freedom to my wife, right? So Dr. Agatev, one of the things that as the owner and as a primary clinician, it just became tough to grow the practice, but also find free time with 2 kids essentially. So just even as recently last week, she was able to go to Korea, take our oldest to Korea, and just go on vacation, get like a facial every single day, and buy as much beauty gear as much as possible. But she wouldn't have been able to do that if it wasn't those 2 associates that were keeping the doors open, right? Keeping the money coming in, and that's very important. It's freedom of time.
And the thing I always say, associate dentists help you with the fun and sadly effed up parts of your practice. I just wrote a email about my dad and his F-bombs that he shares with people. If he was here, you would have liked to seen all this, but he sadly passed away in 2016. We had just hired our first associate prior to that, and my brother and I would not have been able to handle not only the emotional devastation, but also the practice challenge that. So associate dentists protect your practice, just like that babysitter and our amazing team member Morgan. And I'll ask Michael Lobaton, you talk to a few dentists each week, right? In the DSN, would you say, how many dentists do you think
Yeah.
Would you say over 30 dentists a week you connect with at least?
Probably, maybe 30. Yeah, I enjoy it thoroughly.
How many of you met who've hired an associate and want to go back to practicing alone? I'll wait. How many have hired and said, oh, I really want to go back to working all by myself?
You know what? I'm going to say honest answer. I think out of maybe last week, probably 2 people I spoke to want to do that, but only because they made the wrong choice in hiring their associate, right? So one is that they hired somebody a friend of a friend that they thought they knew, right? And so that automatic referral thought, hey, if I like this person, I'm going to subsequently like that person, which is not true. And the second person hired a new grad and did not realize just the amount of effort that would be needed for that person.
I love it. My friend, Dr. Todd Fleischman, I encouraged him to do it about 5 years ago. And he said, I won't go back to practicing alone, because once you get that taste of the freedom for whether it's vacations, like you talked about, right, Michael Lomaton or Michael McKay, just not having to do every single procedure in your office. I do want to share, Michael, because you should be so proud of yourself, McKay. You grew your practice from 1.6 to 4.6 million. Share with us how associates played a role in that.
Yeah, I mean, that 3.3 million number was kind of that solo number, right? And that was the number where I kind of peaked out. That's a crazy amount of dentistry to do as a solo practitioner. Now, I mean, do I have hygienists? Yes. Do I have a restorative hygienist? Yes. I mean, it's not, do I have systems and all that stuff? Yes. But it's a burnout model, to be honest. And so, if you want to keep growing, so you took in that 3.3, that 4.6, that 4.6 model is actually due to the associate. And there's a network effect too, because I have different skill sets in my associate. I've done some more advanced implant training. I've kind of learned a few more things that are a little bit more as far as complex treatment planning. And so what he's able to do is take some of the load off the more simplified procedures, crowns, fillings, easy root canals, and has allowed me more time freed up to actually do more of the more complex surgical procedures that I still have a lot of fun with. And so there's not just the, hey, he's doing work and he's making money for me model. There's also the, hey, he's freeing up my time so I can focus on the part of dentistry that I still find fun and interesting. And honestly, like implants, you get paid a lot more for an implant than doing a crown. And so then that will allow you to actually raise your dollar per hour in the chair while he's working, even same number of hours, but my days on a dollar per hour basis got so much higher because I don't have to sit there and do, patient comes in, just wants to pull the tooth. Well, shoot, that could be like a $200 procedure for, something on Delta Dental versus like, hey, patient came in, wants to do immediate implant. Well, hey, that's a $2,000 procedure, but I'm going to be able to do more of those type of procedures while he's able to handle some of the more, kind of more simple bread and butter dentistry part. So it's not just, hey, there's another person working and making production. It's also the effect that within your own practice, you can start isolating and doing the procedures that are the ones that give you the most joy and energy. And kind of the plus side is usually those tend to be the ones that are a little bit higher value.
I love that. How's your wife approach to this? She share cases with the associates, or does she do more advanced stuff similar, Michael Lomaton, or different?
Yeah, it's the exact same story almost, except for she's actually probably one of the few dentists that actually really likes TMJ. So I'd say about 30% of the practice are fee-for-service TMJ patients that she likes to treat that have gone through the entire gamut of neurologists and chiropractors, et cetera, finally ended up at a dentist. So she loves doing those cases, so particularly TMJ and airway. But finding associates to do that is tough. And so she wanted to pass on the restorative work, the crown work, just the more general restorative work to an associate so that she can focus on those higher end, sort of higher need patients that she really enjoys.
I love that. And, it's one of the things from our mastermind, your good buddy, Jake Conway, he made a really good point this weekend. I didn't ever thought of it. He goes, don't market for new patients if you don't have any places to put them in your schedule. And I never really thought of it like that. But Michael McKay, you're saying, you're doing these high level cases, but you also have to fit in an extraction of number 18 every now and then. And you limit your growth and you test your sanity. Because I was saying, I love food. Like, not many top chefs grow to this level. And they're like, could you also make this turkey sandwich for the next customer? Right? They have a whole system of assistant and associate chefs. And I compliment you guys for doing that. I had on the last slide, Michael, what C did you take to get that kind of training in implants?
Oh, sure. I mean, I went down to Implant Pathways with Dr. Moody down there. I'm actually going out to the Colorado Surgical Institute actually a little bit to bump up my surgical skills a little bit more as well. But if you want to get into implants, definitely some sort of training program. I like the ones that are US based, like the Colorado Surgical Institute, because the patients are going to get taken care of. Their treatment's going to be done well. They're not going to be left out. You hear all those horror stories of those third world countries. So for me, having a US based program where I know the patients were going to get a full complement of care and not be left out in the cold was important to me. Also, like traveling to like Denver is way easier than going down to, someplace in Mexico and then ride a bus across the state line or something. I mean, it's just, but I mean, as far as that's the main C I've been taking I mean, unless you want to call the CI of DSI, which that's actually probably my most credit hours right now is going to the DSI or the Dental Success Institute events. I mean, I've probably hit 3 or 4 of those this last 10 months. I mean, that's my most.
I would ask this, and I know we're talking to the people that we care and loving the DSI and DSN here, Michael Lobaton, but I always I asked this to Michael when we did our video interview for his associate. No, like you're producing 3 million a year, Michael. Like, why do you need the DSI or DSN? Aren't you just like the best of the best? Why do you need other people helping you? I mean, why do you need coaching? It's like, that's just for people who don't know what they're doing. Tell us about that.
Well, we originally joined, well, there's DSI and DSN, right? So originally, DSI came first. We joined DSI as a client simply because it wasn't so much about practice performance. It was more about the ability for both myself and my wife to develop leadership skills, right? So that was the real important part, is really how do you become a CEO, but also how do you just work with other cohorts that are going through the same stuff.
Yeah, that's exactly.
Right. So there's that, and there's DSN, which is a much larger community, but not everybody's ready for DSI. So as you guys know, you guys are actually part of DSI as well. You have to kind of fit a certain criteria to be able to come in. And when we look at, let's say, the black belt status, and I can look at it from both ways, right? There's a black belt in the DSI, but also I'm also a black belt in real life, right? When it comes to martial arts. And it always feels like once you get your black belt, suddenly it's that Dunning-Kruger feeling. I don't know anything, right? So you finally become the expert and you become the master at your craft, then you realize there's actually so much to learn. So even to this day, when I'm 50, every time I step onto the mat, there's going to be some 19-year-old that's going to kick my butt. And I realize, oh, wait a minute, hold on a second. I'm always still learning, right? So even if you may not be physically capable anymore, you got to use your mental chops to be able to overcome those obstacles.
I love that. So great. Just being down there this weekend, and wait, this is that everybody's stressed, whether you're bringing in 10 million a year, 3 million a year. And it's just great to be around. I always call it like the new moms group for a practice that never grows up. You know, my wife was part of a new moms group, but our kids have grown up. Your practice, I always say, is like a 4-year-old child that never really grows up for 30 years. And you need people around you who, like you said, a cohort that cares. Michael McKay, tell us about your experience working with Job Connect. But before you do, I want to set this up, and I think Michael Lobaton will laugh. I went to the Ben Caicos Associate Leadership Summit a day. It was amazing. I'm in the back, and there was a guy who texted me. I won't say his name, but he wouldn't care. And he said, I might do Dentist Job Connect. I want to do Dentist Job Connect. I'm not so sure. Through the DSN app. And he's listening to Ben Caicos, and Ben Caicos in the front goes, Paul Goodman helped me find 4 associates in Louisiana, and it's been awesome. And he texted me, because of what Ben said, I'm going to sign up right now. And I go, what made you want to sign up right now? He goes, well, Ben's endorsement is everything. And I said, do you see how we're just like patients? Because you say to a patient like, okay, you need a crown. They go, who's trying to scam me? But if a patient across the hall gives you a testimonial, they will move forward. So I kind of jokingly said, we need this social proof from our trusted resources, right? And I mean, actually, Michael, John, how did you meet me? You just were scrolling around online, Michael McKay, and did it, or did someone connect us?
Oh yeah, I mean, I asked my friends, and then a good buddy Andrew Vallow connected me, and Andrew Vallow's a killer and a stud, and he is hiring all kinds of people, and he's one of those guys that I am trying to emulate. And so he was the one that said, hey, you know, this is a good place to kind of reach out. Let me hook you up with this other guy. I know Paul, he's a great guy. He helped me, let me help him. And that's the network effect of DSI too, is, you know, like you said, I loved your thing saying, hey, I hit this black belt status, well, I'm done, right? And then it says, no, there's the next level, and then there's the next level, and then there's the next level. And each of those levels have different problems. You're just exchanging one problem group for another. And so that's, again, the network effect, or the people go and say, hey, Paul's a good guy, you should try it. I've had great success with it. You should do it. And I was like, I talked to Paul, and I was like, well, hey, you know, slam dunk. I mean, for the cost to value on this one is like out of control. I mean, sometimes.
Tell us more about that, because recruiters were charging what, Michael McKay?
Oh man, I paid $10,000 for a recruiter for my last associate. And that's not including like all the bonuses and things I have to do, the goodies to get him to come hang out with me. So, you know, that really increases the cost. And, you know, they're just out there, and they're not just looking for you though. They're not just trying to help you particularly. They're out there recruiting. If there's somebody across the street, they might be recruiting for them too. And, you know, for me, you know, the way that Dentist Job Connect, you know, with the interview series and kind of, again, trying to help you and the access to more people within the connection. But again, also, since Paul has such a good memory and works so well with everybody, he kind of knows so many people, he can also be a voucher for you. You know, it's also kind of that like, well, hey, I do know this guy. he's a good guy. I think you would have good success with him. It's kind of a bit of a two-way street in that way as well. I'm sorry, that was a convoluted answer for a short question.
No, I like it. And we charge about 20 with DSN discounts, what feels like, 2,200 to or so, 2,500. And we also give you full access to everybody that you can meet, both applying to your job and the resume search, because we want to make it fun. I mean, Michael Lobaton, there's no one better to talk about your practice than you. So connect with these people, have them come. I mean, I'll ask Michael Lobaton, when you interview an associate, what do they do next? Do they often observe at your practice? Do they, come in for a day and see what your wife does? How do you guys handle that?
Yeah, exactly that. So we don't do traditional working interviews. We actually bring them in for a day, shadow, and just meet everybody, right? So first thing, we want to make sure there's a culture fit, but two, that the work that we do in the office is something that aligns with them
Yeah,
and skill set. And you kind of quickly see, especially for certain people, whether or not they're going to be intimidated by being there or not. And if they can display that confidence, we go ahead and bring them in. And if honestly, we're real about it. If it doesn't work out within the first 90 days, hey, we can move on, shake hands, part
Yeah.
ways. But I did want to add, sort of build off what you were saying too, because I came from the biotech industry. Every job I've had there, I was recruited. And you're saying, Michael McKay, that it was $10,000. Yeah, that's real, right? They're going to charge a certain percentage of what the compensation is. And I think the way that Dentist Job Connect work is actually much more fair in terms of looking for dentists, right? And one thing to note, especially when it comes to recruiters, is that a recruiter just doesn't find you candidates. They actually talk to both sides. They know what your culture is, the way you practice, who you are as a person, and they also know the candidate as well. And so they're going to do some pre-screening on the candidate. I assume that's actually what you do as well. Pre-screen to find a selection of those group of people that best fit your practice. And that's exactly how I found my previous jobs. Is I don't go applying to a major biotech company out of the blue. It really takes a recruiter to build that relationship between the hiring manager and the candidate.
I love that. And I did through Michael's video, which I want to brag about Michael McKay. It's our top Job Connect video of over 1,000 views, because I like you to share your own story so that these candidates, getting out of dental school is not so nuts. You don't know what to do, where to go, and bringing yourself to life through the power of video so that, I think it's dental school does a terrible job about telling you what exists after you graduate from dental school. And by terrible, I mean irresponsible. They don't tell you how to apply for jobs, who to connect with. So we're just this bridge to helping people connect to make amazing relationships that transform your lives. And I say, we need to do more of that. And I know it's part of your mission, Michael Lobaton and Mike McKay, of dentists working together, like in these photos, makes your dental life more fun. I mean, Michael McKay, you got a captive audience for your dental stuff. Michael Lobaton, you got associates who can cover for your wife. So that's really what we're striving to do to help you guys. We always give a DSN discount. You can just text VIP DSN to this number, 215-798-9897. Now, the other M is not here, but he is, here's a picture of us in Philadelphia, Mark Costas and me, when he came in. So you two have to come to Philadelphia next. And
got the celebrity shot right there.
Yeah, hang out and have some nachos.
Yeah, I love nachos. Thai nachos, regular nachos, dental nachos, whatever nachos you got. I'm a fan.
All right, you guys just come out to San Diego because we are where the great Mexican food lives, right? So I'm gonna own the nacho world, Paul. So
I'll come out and see you and Morgan. I don't think she's moving back. I can't bribe her to move back here. So we'll come out and see you guys. But I appreciate sharing with you guys. And I mean, we love what we do. Love working with the DS and DSI crew. Michael McKay, thanks for taking this time extra. I learned a lot about your practice too, Michael Lobaton. So really, really enjoyed it.
Yeah. Thank you guys. Look, I really appreciate your time today. And for those folks in DSN world, I know a lot of you guys are looking for candidates. I know some of you guys actually post on Craigslist or Indeed. Why fight that battle, right? Yeah. You can go ahead and spam it out. And then what's going to happen is those resumes are going to come in. And when you're coming in from a desperate standpoint and they know it, that's actually probably the worst position you can have. So going out, finding a recruiter that actually knows their audience, knows your practice, and putting those two people together, I think is the best way to go.
Let me add one little final thought process here is that, Indeed isn't cheap. When you're searching for Indeed, you're spending $300 or $400 a month at least. And so if you're spending that kind of money a month and it took you 10 months, it's like, wait, I spent $4,000 to maybe get one candidate walk through your door. That isn't a good way to do it. You've got to look at an ROI perspective as far as also the fixed cost of $2,400. And so if you say hey, my last associate, it took me a year on Indeed to find, you go, wait, I spent $400 a month on Indeed. You spent $5,000. It just didn't feel that way. because you spend it at $300 a time. If you spend $2,400 and then get the job done maybe faster, that will save you money. But two, it's a fixed amount that you know that you're probably going to find an associate based off, you know, a fixed cost. And so if you're actually as a practice owner and you're looking at how to make sure that you're keeping your costs low and have a fixed cost for this kind of budget process, this is a way better mousetrap. I know when I go to look for my next one, there's only one way I'm going to go first, and I'm going to call Paul and be like, hey, or I'm probably going to see him at an event, like, hey, next one,
Yeah.
come on, let's do it.
I like it. We're gonna make one of those memes. Better call Paul, like from the TV.
Better call Paul. There you go.
Better
Yeah.
Call Saul. Right. That's your next t-shirt design, Paul.
Yeah. Thanks so much for sharing, guys. You guys
Better
always
give me the
make it so
t-shirt.
good.
I want a Better Call Paul t-shirt, you know?
Yeah. Thanks, guys.
All
Appreciate
right,
it.
everybody. Thank you guys very much. Look at the show notes. You guys know how to get Paul within DSN. You can message him there or contact that number that he posted earlier, and all that information will be in the show notes. Thank you all. Thanks, guys. Appreciate your time today.
Awesome time.